Thank you, Monica. Good afternoon, everybody. It's a pleasure to be with you and to have the opportunity to present this an update of the French Genomic Medicine Initiative. So you do you see my screen?
Yes, perfect.
Yes. Okay. So, as you said, it was launched 10 years ago now. It was upon Prime Minister request with the ambition of integrating genomic medicine into the patient's care pathway. So it's really in healthcare setting, not in research setting. And with the ambition of allowing equal access to clinical whole genome sequencing. So first for rare diseases and cancer, and then for common diseases as new therapeutic indications are validated, and also with the ambition of developing a genomic medicine sector. So when this initiative was launched in 2016, it already relied on a strong organizational framework in France for genomic medicine, genetics, both for rare disease and cancer, through the successive rare cancer plans and rare disease national plan. So in the field of cancer, there was already a network of tumor genetics laboratories, regional laboratories, a network for cancer genetics predisposition, both for laboratories and counseling, and also a network of early phases clinical trial centers. And in the field of rare diseases, there was also a network of regional diagnostic laboratories, a center of reference, thematic rare disease health networks, and also a national database. Okay, so you can see here an overview of the organization that was set up. So with the structuration of a genomic healthcare pathway, I will present it later. 2 clinical whole genome sequencing laboratories, 82 clinical pre-indications, and also if this initiative was set up in a healthcare setting, there was also a strong continuum between healthcare and research, and there was the development and structuration of a dedicated IT infrastructure, which is a CAD for Central Data Analyzer. So the first two clinical sequencing clinical sequencing laboratories are operational. So the first one is a Sequoia. It is based in Paris, and the second one is Oragen, which is based in Lyon. These laboratories were selected through a call of proposal launched by the Ministry of Health. These 2 laboratories have a generic activity, both for rare diseases and cancer. They have status of clinical laboratories, which has a strong impact on the organizational point of view with processes of accreditation, for example, and they must provide equal access for all patients in France. And that's why you can see on the map two geographical areas. So all the patients who live in the northern and western part of France, their samples are sent to Sequoia, and all the patients who live in the eastern part and the southern part of France, and also in the West Indies, their samples are sent to Oragen. And the organization must be integrated into the patient's healthcare pathway and also into the existing healthcare networks. So for rare diseases, Oragen and Sequoia perform whole genome sequencing mostly of trio. And for cancer, it's a more complex protocol with both tumor whole genome sequencing, whole exome sequencing, and RNA-seq, plus germline whole genome sequencing. It is possible to prescribe whole genome sequencing for well-defined pre-indications. So 5 rounds of selection that have been organized to date. These pre-indications are proposed by health professionals, and they are validated by a working group led by the French HTA agency, Haute Autorité de Santé. Up to now, 82 pre-indications have been validated, 67 for rare diseases, 4 for cancer genetic predisposition, and 11 for cancers. And at term, this pre-indication will be evaluated by the French HTA agency, Haute Autorité de Santé, for long-term reimbursement. And if they are positively evaluated, they will become a clinical indication. That's why we call them with this strange name as pre-indication. And the Ministry of Health also funding a national medico-economic evaluation project whose name is SECOGEN. There was also the structuration of a medical pathway for all these pre-indications, with mainly the structuration of multidisciplinary meeting before whole genome sequencing and after whole genome sequencing. And then this medical pathway has been adapted for each pre-indication, mainly with the structuration and setting up of these multidisciplinary meetings, the organization of sample circuits, and it is more complex for tumor samples. Also with the definition of a diagnostic strategy, whether whole genome sequencing is performed in first intent or after gene panel sequencing, with vetting of prescriber and also with the gestion of clinical biologists. And there was a continuous improvement of this genomic pathway. For example, with the creation of local non-thematic multidisciplinary meeting for rare diseases in order to simplify the process. For cancer, there was a pilot study for using FFPE samples, so fixed sample for cancer patients. And there was also the structuration of a network of what we call genomic pathway managers, who are health professionals who were hired locally in local hospitals in order to help and to assist clinicians to navigate into this genomic pathway. There was also specific consents that were drafted at the national level. They were drafted by lawyers from the Ministry of Health and a working group with clinicians, biologists, and patients' representatives. So the consent model have been adapted to each patient situation for cancers and rare diseases, for adults, underages, diseased children or fetus, and also for family members. And in addition to consenting to the genetic test, patients may consent to many things. They may consent to being informed in the event of discovery of germline data linked to the disease. So it's for cancer patients. For the time being, then it is not possible to consent to incidental findings. They also may consent to reusing their samples and or their data as part to continue their diagnostic process. They may also consent to storing their biological samples and or their data for reuse and research. And they have also to define how to communicate the information to their family members in the event of the positive results. It is a legal obligation in France. So as they have to consent to many different things, and it is a complex situation, there was the drafting of information notices, and several versions have also been drafted for tumor genetics and for germline genetics for adults and children, and they were adapted and suitable for different levels of understanding. I put some example on the slide, and you can see that some of them are very, very simple. And these leaflets have been translating into several languages for non-active French speakers. So where are we now in terms of activities? So since 2019, 58,000 requests have been received, and you can see their distribution on the upper right graph. So 80% of our rare disease patients and only 20% of our cancer patients. So clearly, cancer organization is lagging behind compared to rare diseases. 44% 2,200 clinical reports have been signed. And if we consider the fact that it is mainly for trio patients, it means then more than 150,000 individuals have been sequenced so far in the framework of the initiative. And you can see also on the graph the evolution of a number of prescriptions that have been received. And there is a continuous increase of the activity since the start of the sequencing activity. So you can also see that the sequencing activity really started in 2020. So it shows that it took time to structure all this organization and make it really operational. And you can see on the last graph the evolution of a number of medical reports for all pre-indications. So in 2025, we have received almost 70,000 medical prescriptions, and the same number were signed as medical reports. We also evaluate and follow as an indicator the geographical distribution of prescription, because it is important to assure that there is really equal access in the country. So you can see on the left the geographical distribution of prescription for rare disease patients, and you can observe that it is quite the number of expected patients, and there is quite a relative even distribution on the French territory. It's a completely different situation for cancer patients, because it is the same scale of course. So you can see again there is a few cancer patients who are addressed to the initiative, and moreover there is a very uneven distribution in the country. As I explained in the introduction, it is very important to allow secondary use of genomic data within the framework of this initiative. It is a dynamic of open science. It means that we would like to ensure wide opening of data while ensuring their security and respecting scientific and ethical criteria. So we have structured an IT infrastructure whose name is CAD, so collecteur analyseur de données. CAD is a one-stop shop for PFMG 2025 data. So it is a collection of genomic and associated clinical data with a library of bioinformatic tools, a national secure IT infrastructure, and there is also the development of a variant-centered knowledge database. And CAD will be the French node for the European 1+ million genome initiative, that I also will say some words after. So again, it took time to structure this infrastructure, and it is only becoming operational. So up to now, 2 projects have access to genomic data and have begun their first reanalysis. And for 3 projects, data have been transferred to CAD, and bioinformatic tools are being prepared for use in the secure test. And so far, about 17 projects have been validated by the scientific and ethical committee. So regarding international cooperation, so the French Genomic Initiative is actively participating in the European 1+ million genomes initiative, whose objective is to enable secure access to genomic data and the associated clinical data in Europe, both for research, healthcare, and public health. So we participate in 2 in two projects. The first one in genomic data infrastructure to develop a federated infrastructure to share genomic and associated clinical data. We also participate in the Genome of Europe project, whose objective is to sequence 100,000 individuals. And we also co-lead with Portugal the working group 7 of 1+MG, whose objective is to implement genomics in healthcare. We are also partners of the European Rare Disease Research Alliance project, which is a huge project led by INSAM, and whose objective is really to facilitate research in the field of rare diseases. You can see an overview of this project, which is quite complex, and more specifically, we participate in the clinical research network. So the objective is to allow the reanalysis of genomic data for patients with the negative results, and it is an extension of the previous Solverdi initiative. And so for patients that have been sequenced within the French Genomic Medicine Initiative, we will share patients with a negative whole genome sequencing results, and we hope that it will be the opportunity to solve some negative results. And this project is built on the 1+MG initiative, and more specifically on the GDI infrastructure. And we also have launched collaborations with other European Genomic Medicine Initiative, and here the objective is to share experience and best practices. So we have signed so far a collaboration agreement with Genomics England and with Genomic Medicine Sweden, and with the Danish National Genome Center. And more recently, we have signed an agreement with the Outlook Medical Foundation, which is located in the Netherlands. And we hope to sign soon a collaboration agreement with the NHS Genomic Medicine Service in the UK. So to conclude, we can say that 10 years after its launch, the French Genomic Medicine Initiative has successfully integrated genome sequencing into the French healthcare system, both for rare diseases and cancer. Nevertheless, you can see that there are many remaining challenges. First, the low number of prescriptions for cancer patients. We have also to address clinical biological interpretation and turnaround time, mostly for a rare disease patient, but it is also a challenge for cancer patients. We have also to address and reduce the complexity of a genomic medical pathway. We have to better involve patients and citizens, and we have also to accelerate data sharing and data access for research purposes. And finally, what is next? What are the perspectives? So we are moving towards the implementation of a 2030 or 2035, I don't know, French Genomic Medicine Initiative, or PFMG version 2. So we are now in the process of the evaluations of the current initiative. It is performed by both the Ministry of Health and Ministry of Research. And there are also the setting up of working groups to drive the second phase of the initiative. There will be a joint report both by the auditors and by the heads of this working group. This report will be sent to the Ministry of Health and Ministry of Research, and we hope that both ministries will take the decision to launch the next phase of this initiative. And finally, I would like to thank you, and I will be happy to answer your question. And I would like to stress on this slide that this project is really a collective project, and it is not only a question of the structures that have been set up, but only all the clinicians, all the biologists, patients, citizens, institutions. There are very many people who are involved in this initiative. Thank you for your attention.